Tens of millions of people in the U.S. are struggling to get a good night's rest due to a condition called sleep apnea, and a lot of people might not even know they have it.
Yeah, thankfully, modern technology is now alerting people, though, to possible cases. Our 90s medical expert, Dr. Paul Coley, is in this morning to talk about how devices like the Apple Watch are really helping people out. Dr. Coley, good morning.
Good morning, guys.
All right, before we get into what the Apple Watch does, let's just talk about sleep apnea in general first. What is it, and what are the risks for people who have it?
Yeah, so sleep apnea is exactly what it sounds like. It's during sleep you go apneic or you stop breathing. And there's sort of two causes of it. One is that your neck muscles kind of relax a little bit too much. So when you're lying on your back especially, they kind of squish your airway. So think about like pinching a straw off. If the air can't get in, your oxygen levels go down, you stop breathing, you go apneic. That's called obstructive sleep apnea. The second is called central. Your brain forgets to breathe. This can happen if you drink too much alcohol, take Benadryl, or have other sleep disorders. So a lot of people have sleep apnea, and if it's not diagnosed, it can lead to heart disease, lung disease, car accidents, dementia. It can even cause a lot of problems with a lot of chronic issues like cognitive function, anxiety, and such.
How is it typically diagnosed?
So usually what we do is called a home sleep apnea test, where we put oxygen monitor on your finger, we put a respirometer, which monitors your breathing and your heart rate, and the combination of your oxygen, how much you're breathing, what your heart rate is doing, because the heart can also pause when you're not breathing, will tell us that you have sleep apnea. Oftentimes the partner will actually tell us that somebody has sleep apnea because, they stop breathing. They look like they're choking, or they're kind of wake themselves up snoring. It's not the snoring that's waking you up, it's the lack of oxygen that makes your brain freak out and says, wake up and take a breath. So sometimes we'll get information from the partner. Me as a cardiologist, sometimes I'll see changes in the heart before the patient even knows that they have sleep apnea that are suggestive of lack of oxygen during sleep.
Yeah, mine was the forceful shove in the middle of the night that would wake
Your
me
partner.
up often. Yes, from my partner. How does this watch, though, now, the Apple Watch feature, how is that really helping to diagnose sleep apnea in people?
It's really kind of cool. So it's an Apple Watch Series 10 or more, and sometimes the older ones with the software update, but it has an accelerometer, right? When we walk, it can tell that we're walking. So it monitors movement, and that's a surrogate for breathing. So if you're not moving, you're not breathing, probably, right? And so it looks to see whether or not you stop breathing during the course of the night, and you have to not breathe for a certain amount of time, and also a few days, and then it tells you whether or not you have sleep apnea. So the way that it performs is better, of course, if you have more severe sleep apnea. So overall, about 66% of people with sleep apnea will get picked up. So you're missing a huge proportion that have more milder versions of sleep apnea. But if you have sleep apnea, it goes up to 89% if it's severe sleep apnea that the watch picks up.
It sounds like great technology. I have a Series 3 watch or something like that. Like, it's old school. So should people go out, get an upgraded one, or go out and get one in general?
So not yet, I would say, for a couple of reasons. One, it's a little bit of a backwards approach, right? Usually we start with symptoms, signs and symptoms, and then we do testing. This is kind of the opposite. You're doing the testing before you do the signs and symptoms. Now, that may be helpful if you're not aware of your symptoms, but the other problem I have with this is that it doesn't have an oxygen detector. So the watch used to have a pulse oximeter, but because of a lawsuit that Apple had, they had to actually take that feature off. But it's really important to know whether or not your oxygen levels are going down, because that also helps us determine whether or not that sleep apnea is clinically significant, which of course is harder in people of darker skin. You can't necessarily detect oxygen levels through pulse oximeters quite as well. So I think if you have an Apple Watch already, that's a Series 10, turn on that sleep feature, because if it alarms, it's pretty sure that you have sleep apnea. But if it doesn't alarm, it doesn't mean you don't have sleep apnea, and it also means you might need to follow it up with a regular test, like a sleep apnea test, to see what the oxygen is doing.
And what I will say, I think a lot of people are scared to be diagnosed with sleep apnea because they think they have to be hooked up to a CPAP machine, which, by the way, if you do have severe sleep apnea, I recommend getting on that CPAP machine. But for the milder sleep apnea diagnoses, I got a mouth guard from Dr. E. Dental Otry. Shout out to that team down there. They're amazing. That pulls my lower jaw forward.
Yes.
And it helps me breathe. And I sleep with nasal strips on top. I'm super attractive. I'm super attractive when I go to bed.
So you're tenting your nose open.
Yes.
And you're pulling your jaw forward, but pulls your tongue forward.
Yes.
So exactly as you said, for mild sleep apnea. And this can be life-changing, guys. Because the quality of the sleep that you get is so amazing that for a lot of people who get used to even the CPAP machine, they'll never go back. I have patients who travel with with it on vacation and such, because you wake up feeling like a whole new person. You have a new lease on life, not to mention the cardiovascular risk, the heart disease risk, pulmonary hypertension, all the other things that go with sleep apnea. So I would strongly suggest, like you said, don't be afraid of it, be empowered. Because sleep is such an important thing.
You don't realize how much life you're missing out on by not getting that good rest.
You may not look super attractive when you sleep, but at least you and your partner are getting great sleep.
Oh no, he finds that super attractive because he stays asleep the whole time now. Yeah, it's great.
Sleep is good. Dr. Coley, thank you.